Yes, you could check on worstpills.org, which is I think a very good website for Consumer Reports. Also has really good. I'm biased. I write for Consumer Reports. Consumer Reports has done I think some really good analyses. But you know, over-the-counter drugs is actually it's kind of like herbal treatments. I don't know very much about them. So, I mean, for a drug to be a prescription drug, it has to be. It's just basically considered more powerful and has more potential for safety issues. That's why it becomes only available through a doctor. Where the other stuff, you can walk into a pharmacy and buy aspirin or over-the-counter stuff because it's considered weaker and not as potentially dangerous. In terms of the regulation, the US has a better system in terms of finding out the actual clinical data on the drugs. So when they're reviewing a drug to decide whether they're going to give it a license or not, they will post reviews on the internet, and so that independent researchers can download that and examine it themselves. It's a great thing. Canada doesn't have laws like this, so that when Health Canada decides to tell you what they were looking at, you get a thing called a summary of decision. They've summarized it and put it up there, but you can't really find out how many people had serious adverse effects and so on. So Canada's, but it's not a problem because we can always look at the US's, the US FDA's website. In terms of consumer protection, you know, the US is a very litigious kind of place. And whenever there's a drug problem like Vioxx, there's suddenly, you know, thousands of lawyers jumping up and starting class action lawsuits against the companies. And my understanding is it's a lot harder to sue a drug company in Canada than it is in the US. And so in terms of, if you're thinking of that in terms of consumer protection, the US also has a very interesting thing called the whistleblower legislation. So if you're working inside of a drug company and you see some bad things happening, and you decide to take a briefcase full of documents to the regulator to show them, look at what they've been doing, you can get compensated for that. In fact, there was a big case a number of years ago where the company was sued for something like $1 billion for, they lost a case close to $1 billion for what they call off-label prescribing, off-label marketing. So they were telling doctors, oh yeah, the drug is good, it's approved for this, but it's also good for this, this, and this. So the doctors, this was a drug called Neurontin. The biggest scandal, if you want to read a scandal about off-label prescribing. But the people in the companies that blew the whistle, they got rich. I mean, they got a small percentage of the final settlement, but they got several $1 million to do that. We have no such legislation in Canada. Yeah, so some of the drugs can be ground up and snorted, not the ones which are a sustained release. So in fact, the newer ADHD treatments, I think it's Strattera or Adderall. Actually, Adderall may not even be on the market anymore.
No, I don't think it is.
That's right. So the older ones, they have, there's quite a bit of evidence in the US anyways that the drug gets ground up and snorted, and apparently it delivers some kind of high. And that's what they mean by abuse. So you'll get some kids selling them in the schoolyard or stealing them, or stealing prescription pads and getting these drugs and then, you know, abusing them in that way. I think it's probably, it's safer in the sense that it's not as bad as the older ones. I think it probably still has a potential for abuse. The companies actually marketed that particular drug on the basis of less risk of abuse. So it was quite funny when I saw the ads. It was like, it's not that this drug is any better than the other one. It's that this one is less likely to be stolen by somebody, ground up and sold on the street, or that was its marketing message. So I'm going to stick around if you wanted to. Oh, that was the psychiatric awareness. This is actually a group that has connections in Victoria and in the UK. If you're interested in psychiatric drugs from a patient's perspective, I would recommend that you take a look at this site.